Welcome to Facts and Issues, nonpartisan conversations of public interest brought to you by the League of Women Voters of Monmouth County. Today's Facts and Issues explores Monmouth County's health with guest Christopher Merkel, Monmouth County Health Officer. Here's our host, Marie Curtis.
Hello, everyone, and welcome to Facts and Issues. With me today is Christopher Merkel, our Monmouth County Health Officer. Welcome, Mr. Merkel.
Thank you very much.
And since we've just come through this COVID pandemic, I thought it was an appropriate time to ask about Monmouth County's role in the pandemic. So what have you been doing? I'm sure you've been busy.
Yes, we've been very busy. Thank you, Marie, for having me today. Monmouth County Health Department's role in the pandemic was a significant role, as this was a declared public health emergency in the state. I believe one of the first, if not the first in the state's history. So as that being the case, local health departments took a forward-facing role in combating COVID-19 pandemic. Typically, the health department's role is behind the scenes. We do a lot of prevention, and I can go into later some of the programs that we do. But as far as COVID-19 pandemic response, we had a lot of roles. Some of the bigger roles we had was first and foremost contact tracing. Local health departments did some contact tracing in programs, but never anything to this magnitude. We worked around the clock. We used volunteers early on in the pandemic when Governor Murphy issued the stay-at-home order in March of 2020. We also utilized school nurses in the county to help with contact tracing, and a lot of our Medical Reserve Corps volunteers. And I can go into later what the MRC is. So that was very important to talk about isolation and quarantine, to talk to people about the requirements if they fell ill with COVID-19, if they exposed other individuals or family members or other people with COVID-19, to ensure that COVID-19 didn't spread more than it had to. Some of the other activities that were of note, certainly the vaccination initiative. When the vaccines came out in early of 2021, we set up mass vaccination clinics throughout Monmouth County. Two of the big ones that the county health department supported were the large vaccination clinic at Brookdale Community College and the county agricultural building in Freehold. Also, we worked on testing individuals, testing county employees, testing other people to determine whether they had the disease or not.
It sounds like an awful lot of work.
For sure.
And you mentioned answering questions. That was with a phone bank that you actually set up. Is that correct?
So contact tracing was separate from the phone bank. The phone bank was more for the public to call in and get questions answered as it related to COVID-19. If they had general questions or if they had questions about locations of clinics or other related questions, we set up a mass phone bank, and it was in the early stages, ran every day, even weekends for a little bit. And it was a collaborative relationship between county departments, our county, Monmouth County Sheriff's Department, and our volunteers to make sure we had enough volunteers to answer the volume of questions we were getting initially.
Okay, you mentioned volunteers. How did you get those volunteers? You had a sudden need for a lot of people.
Yes, the Monmouth County Health Department had an established uh, volunteer group known as the Medical Reserve Corps.
Oh,
Each county in the state, I believe, has a MRC. The MRC was established, I believe, right after 9/11 with then President George W. Bush. There was a identified need for volunteers, and that sort of evolved out of September 11th, 2001. Since then, the MRCs in New Jersey and across the nation have really grown, especially during and after the COVID-19 pandemic. We had a great core of volunteers. That was one of the positive things that came out of the pandemic, that a lot of people want to volunteer their time. And we have a lot of nurses and doctors and actually non-medical volunteers. The MRC is a group of medical and non-medical. So we had the need for volunteers, not just for doctors and nurses to administer a vaccine, but registration early on, clinic flow when the clinics were very large, and a lot of those other logistical non-medical activities that are needed during a clinic.
oh my goodness. Well, I wasn't aware that you had your own little army of volunteers all ready to go. That sounds like a
Yeah,
very wise move.
yes, and
Um,
I would say real quick, Marie, that without our MRC, there's no possible way that the health department could have accomplished what we did in terms of vaccination clinics and testing clinics. Without our volunteers, it would have been impossible to do what we did on behalf of the residents in Monmouth County.
well, that's wonderful to hear, and I'm so glad that our people have stepped up. But COVID, while it was foremost in the last couple of years, is not the only responsibility. I think our viewers would be very surprised at the scope and breadth of responsibilities that the health department covers. Do you want to tell us some of those things?
Yes, absolutely. I could spend hours talking about all the programs and activities we have at the county health department, but I'll touch on a few. Obviously, everybody knows the health department's involvement during the pandemic, and that sort of, in my opinion, in a positive way, shed light on the health department and what other services we provide. Monmouth County Health Department and all health departments' mission is really prevention, to prevent disease, to prevent people from getting ill, and to prevent large-scale outbreaks. So some of the other things we do that impacts people on a daily basis. We all love to eat. We all, a lot of us go out to restaurants to eat. So if you've been to a restaurant, it's a good chance that the health department has been there inspecting to ensure that that restaurant is taking safe and healthy measures to ensure that the food they are serving to the public is safe to eat, and that you don't get sick from the food that you are consuming in a restaurant. Some of the other things we do, rabies prevention. If there's a dog or an animal bite, if a dog bites someone, or a domestic pet is bit by a raccoon or a wild animal, the health department gets involved to ensure that animals and people do not contract rabies, which is a fatal disease. Um, some of the other things we do, summer's coming up, we're in the spring now. So there's a lot of children and people who will be going to public pools. And the children will be going to summer camps. The health department also inspects youth camps to ensure that they are meeting the safety and health standards of the state of New Jersey. And we also inspect public pools to ensure that those pools are safe when you are swimming in them during the summer season.
Okay. And you also monitor children's health, I understand. And make sure that they have the proper inoculations, et cetera?
Yes, well, one of the other clinics that we do, the health department is charged with providing health services to those residents in our towns in Monmouth County that are uninsured or underinsured. So
And
sorry.
so you provide those inoculations free of charge?
Yes, for those populations, we have a weekly children's immunization clinic that is provided to those individuals, those children, free of charge.
And how, if someone were interested, how would they contact you to find out about that?
They can contact our main number, 732-431-7456, and they can make an appointment with our great clerical staff.
Oh, very good. Well, that's something that I totally wasn't aware of. But not only are you responsible for pets and people, but I understand you're also hazardous materials fall under your responsibilities.
Yes, absolutely. And I actually started my career as a hazmat responder at another county health department. We maintain a trained and qualified hazardous materials unit, and here in Monmouth County that responds to any hazmat related event in the entire county of Monmouth. So typically, they are requested by a local fire chief or police chief. Some of the things that the hazmat team gets involved in is transportation incidents. So if there's not necessarily a motor vehicle spill, usually local fire department handles that, but larger spills, cargo tank containers that are rolling through our highways in Monmouth County. If they tip over or get into an accident, the hazmat team will respond. Any type of factory release of chemicals, the hazmat team will respond, or other things, abandoned drums. We typically, again, the summer season's coming, so we always every year have residents who mistakenly mix pool chemicals that they shouldn't be mixing, and you get a release of chemicals that the hazmat team responds to. So they do a myriad of different things, and they're always training to make sure that they're ready for the next incident.
Oh my goodness. That really sounds like hazard duty there, obviously.
Yes.
And I understand that in general, you're responsible for environmental enforcement in the county.
Yes. So, in addition to the hazmat team, the Monmouth County Health Department has a grant contract with the New Jersey Department of Environmental Protection. So the hazmat response is one of those required activities under our contract with DEP. In addition to that, we do a lot of other things as far as environmental health goes. As you know, Monmouth County is a coastal county, and we have a lot of towns who have recreational bathing beaches during the summer season. One of our programs and charges is to sample the bathing beaches weekly to ensure that the levels of bacteria do not exceed the state standard, um, because we want to ensure that the bathers that come to Monmouth County are safe when they're swimming at the ocean bathing beaches or lake bathing beaches. Any bathing beaches in Monmouth County, we sample during the summer season.
Oh my goodness. And I understand you're also responsible for septic tanks and
Yes.
what do you look for there?
So septic inspection. So for those residents in Monmouth County, it's mainly the western part of the county that's more rural. Those residents are on individual septic systems, so they are not tied into a city sewer system. So we work with new construction. So if there's a new house, we review the engineer's plans for the individual septic system that will be serving that house, approve plans, and then we work with the septic installers to ensure that the installer is installing the system based on the engineered design plans. So we sign off on them and work with the towns to make sure that before they get a certificate of occupancy for the house, that the septic has been installed properly and improved by our department.
Okay. And I understand that the mosquito control also comes under you.
Yes. Yeah, I have a couple responsibilities. So we work very closely with our Division of Mosquito Control, which falls under the health department's purview. And they do a tremendous job. I'm not going out on a limb to say that our Division of Mosquito Control in Monmouth County is the best in the entire state of New Jersey. We have very published, renowned employees that look at not only mosquitoes but ticks as well. So we have a lab at Rutgers that the ticks are looked at. They're counted every year, and the mosquito division comes up with methods for prevention of tick bites. They do a lot of education, and also the mosquito control. They will go out at the request of a homeowner to evaluate their property, to take mosquito samples, and they send them to the state lab for not necessarily identification. They do that in-house, but presence of disease. As we know, mosquitoes spread disease. West Nile virus is a big one in New Jersey that has sickened individuals and unfortunately killed individuals in the state. So they are continually doing monitoring of water areas. They're treating water to kill mosquito larvae. Mosquitoes start as in water in the larvae stage, and then we come to know mosquitoes as flying adult mosquitoes that are very pesky during the summer season, and can create a nuisance for our residents here in Monmouth County and actually bite people and get them sick and worse.
Oh my goodness. There is so much involved with health that comes under your responsibility. And I
Yes,
also understand that you get involved with STDs and
yes.
testing and education there.
Yes. So, yes, we have a sexually transmitted disease program. We have a what's called a DIS, a disease intervention specialist. They follow up with partners and try to prevent STDs from spreading. We also have a STD clinic weekly. We have a cooperative contract with Jersey Shore University Medical Center in Neptune that runs the STD clinic every week so people can get tested and treated free of charge. And STDs certainly are a major concern. The numbers keep going up every year. The CDC STD report is unfortunately discouraging with the huge increase in STDs. not only here in New Jersey, but across the nation.
Oh dear.
And we are basically at historic rates that we've never seen before. In the early 2000s, syphilis was almost eradicated, and now they are at numbers never seen before. Also, congenital syphilis that affects the newborns is at a very high rise. Just a few years ago, we had really little to no congenital syphilis cases in New Jersey. Now we have tons of them, unfortunately.
Oh dear. Is that possibly a result of the COVID lockdown?
Um, there's various reasons for the increase in STDs. I think the lack of awareness, the lack of people protecting themselves, and certainly the COVID pandemic did not help, not only with STDs, testing and treatment, because a lot of the preventative care, as we know, was not done during the height of the pandemic because for the fear of the disease. A lot of
Mhm.
doctors' offices were not doing elective surgeries or not doing a lot of testing and preventative care because of the fear of the spread of COVID-19. And now that's certainly a contributing factor, not only with STDs, but children who were behind on their vaccination schedules because they were not going to the doctor. um, Lead poisoning. We're fearful that we're going to see a huge increase because the children spent a lot of time at home, and their primary home is typically where they get lead poisoned because of the lead-based paint chips and dust.
Oh my goodness. I had no idea that the lockdown led to bad health implications as well as avoiding COVID. So it was a,
Yeah, sorry.
no, that's a,
Unfortunately, Marie, you are exactly correct. Um, when we talk about the pandemic, obviously we talk about the unfortunate loss of life and the individuals who died due to COVID. Um, but COVID affected everything, every facet of our life. From children being behind in their education and not being on grade level because they were forced to do remote learning, and some children just it's difficult for them to learn remotely. And those numbers from the Department of Education are clear. From businesses closing to other health-related items, uh, you know, uh, people and children not following up with their doctor for their routine checkups, increases in other diseases that will the numbers will reflect that as we move forward. Because if you're not getting your regular checks for cancer or other diseases, then those diseases have the opportunity to spread in your body unchecked. So the pandemic really changed life as we know it. Um, you know, there was the pre-COVID life, and now it's everything after that.
oh my goodness. I had no idea that it had affected so many other aspects of the health of our citizens. It really
Absolutely.
is amazing. I do have one other area. Are you responsible, since you have the environmental health of the county also? Do you do the water testing for people who have wells, et cetera, or is that somebody else?
So there is a law called the Private Well Testing Act. So that covers new well construction for individual wells.
Okay.
Again, mainly on the western part of the county, that's more rural.
Mhm.
And the Private Well Testing Act of New Jersey also covers when there's a change of ownership. So when
Oh,
somebody
okay.
goes to sell their house, they are required to test for certain certain parameters, certain things within your drinking water. So we do sort of get those reports, and that is part in conjunction with the approval of the septic system for new construction. We also look to ensure that the well was drilled properly and that the appropriate water samples were taken during new construction.
Okay. Well, you certainly wear many, many hats in this county. And I think we all owe you a big debt of thanks for all that the county health department does. We're coming close to the end of our program here. You mentioned a free STD testing clinic at Jersey Shore.
Yes.
Does that require reservations?
No, people can just show up. It's on Tuesdays in the afternoon. They can check our website for the specific details of the location and times and those types of things.
Okay.
The other thing, Marie, I want to mention really quick is that the health department spends a lot of time trying to educate our residents about our services. In addition to the website and them calling us directly at the office here, our office is located in the Borough of Freehold. We also have a free mobile app. Most people have a smartphone nowadays, so they can download apps. We have a free Monmouth County Health Department app that you can download on your Apple device or smartphone, Galaxy phone. And the advantage of the app is that you get real-time information about health-related issues in Monmouth County and across the nation. Also, they get what's known as push notifications. So if we, for example, we have a clinic that day, there will be a notification on the app that says, we're having a clinic today at this time at this location.
Okay, well, that's very helpful to know. And do you want to give our viewers that phone number again, just in case they want to contact you?
Yes, absolutely. Our main number here at the Monmouth County Health Department is 732-431-7456.
Thank you very much. And thank all of you for being with us today. And I thank Mr. Christopher Merkel, the Monmouth County Health Officer, for all of the many responsibilities that he carries for the health of all of us here in Monmouth County. I hope you'll be with us next time. This is Marie Curtis for the League of Women Voters.